I'm telling you guys, you're not going to get me back in a face mask. I'm just not going to do it. I'm not. All right. And the more I keep hearing about these production companies like LionsGate and these colleges that are still requiring face masks or going back to face masks, and then I didn't even know this, but there's a good amount of colleges that are still requiring the vaccination. So we're going to get into this, guys, and just make sure we go over what they're doing. Make sure it's not trying to gain as much steam as it's kind of seeming like, and just making sure that all us regular people are on the same page, and we're just not going to go back to that crap. Because there's honestly, if you want to wear a mask, wear a mask. All right, but we're not going back to mandates. Why are we mandated across the board? Pick and choose what's best for you. That's how I roll. But we're going to get into it, guys. Welcome to Getting to the Facts. I'm your host, Andrew Curiel. And before we get into it, if we could smash that like button, subscribe to the channel if you haven't already. We've been doing this a little over 2 months now, and we just keep growing, all right, little by little. So I think we're already at 82 subscribers. So really appreciate you guys. And like I said, I'm just going to keep trying to do my best for you. But we're going to get into this here. And this is from CNN, because you always got to bring out CNN every once in a while. It may be time to break out the masks against COVID, some experts say. If you're at high risk of serious illness or death from COVID, it's time to dust off those N95 masks and place them snugly over your nose and mouth to protect yourself from a recent uptick of the virus, according to a growing number of experts. That advice should go all the way up to 80-year-old President Joe Biden, said Dr. Jonathan Rayner, a cardiologist. Octogenarians comprise the highest risk group for complications following COVID infections, Reiner said. At least until the numbers start to drop again, it would be appropriate for President Biden to take some precautions and wear a mask in crowds. Yeah, I mean, he's over 80 years old. Other high-risk groups include people with diabetes, cancer, chronic liver, kidney, or lung disease, organ or stem cell transplants, HIV, or other immunocompromising conditions, a history of heart disease or stroke, dementia, or mental health issues. If you're a caregiver for somebody who is at increased risk of complication following infection, then I think you should also consider putting a mask on in public places. And guys, I mean, honestly, all that I have no problem with. I mean, and it's just recommending, so I'm cool with the recommendations. That's not really my concern too much. It's about the mandates. Right. And if you're going to be around people that are kind of compromised health wise, they have some possible comorbidities and stuff like that. You really want to make sure you take your precautions too. Just protect them. It's not that you're going to necessarily kill them, but that it just gives that little extra protection for the older people and the people that have health issues. Completely understand that. But we're just not going back to the ones where we're going into businesses. Okay. The elderly people and the people that are compromised, they need to take their precautions. Let them wear their masks. Okay. Because if I'm wearing a mask, I mean, yeah, it doesn't mean anything goes out, but if the person that is at risk, they're the ones who should be protecting themselves. That way they're good. If someone wasn't wearing a mask anyway, they got the protection. That's really what it comes down to, guys. And I think that's my biggest thing whenever it came to this COVID stuff and it came to the mask mandates. It's just like, we don't need to mandate. Anyone who feels that they are at high risk of COVID really hurting them, they need to wear the mask, not the other way around. It just doesn't make sense. But we're going to go over here to this other article as well. This one's from CBS News. A familiar pandemic era safety measure is making a comeback as new COVID variants surface and cases of the disease flare in some parts of the U.S. Mask mandates. The number of COVID-19 cases has climbed for several weeks, with health authorities saying they're tracking the spread of 3 new variants. It can't just be one, guys. I mean, how do you have 3 different ones at the same time? Anyways, as a result, some businesses and other institutions are again requiring people to wear masks, which have proved an effective tool for slowing the spread of the virus. Which, please, there's no data saying that it helps stop the spread or slow the spread or anything like that. That is absolute bullshit. Okay, excuse my French, but that's just absolute BS. There's never been a study that I've ever seen, and I really was digging. There's no study that shows that masks actually at a significant level really help slow the spread. It's just not. There's not. And that's the biggest misconception is masks really did something. No, they didn't. People were wearing little surgical masks that they put on their rear view mirror for like 5, 6, 7 days straight, sometimes weeks. Like, come on, guys. Let's just be real. Sometimes it would fall on the floor. We got crumbs. You got goldfish from the kids or whatnot, and you still put it on. Blow it off, good to go. So, it's just absolutely stupid when they say that masks really did something. But like I said, if you feel that you need it, wear that N95 if you feel like you need it, but not to be a mandate, guys. Again, I think we're all on the same page when it comes to that. And if we're not, we really need to. I mean, if we can't find common ground on this, just on freedom to do what's best for you, then we are really at a loss for words right now. But let's see what they have here as well. Like vaccine requirements, cities and states have widely dropped mask mandates as COVID rates have dropped since peaking in 2022. In February, for example, New York State dropped a requirement that face coverings be worn even in healthcare settings, in line with guidance from the Centers for Disease Control and Prevention, after most other local businesses had already nixed mandates voluntarily. Morris Brown College in Atlanta said this week announced that the small liberal arts school is reinstating its mask mandate for 2 weeks, citing COVID cases among students. As of Tuesday, the school required that all students and staff members wear masks, according to a statement from college president Dr. Kevin James. And again, guys, it's just, I mean, can we please just really just have personal freedom to do what's best for you? As long as you're not hurting anyone or getting in the way of an individual's right to pursuit of happiness and their personal freedoms, then really, why are we doing this? And I think a lot of people woke up, from the pandemic. I really think there's a lot of people that did fall in line with those mask mandates the entire time. And this time around, if they do try to do something like that across the board, there's going to be strict resistance. I mean, I think a lot of people smartened up, and I really don't see us doing that again. It'd be very hard pressed for me to see the majority of the United States really fall in line like that again. And I think that's what scared me too during the pandemic, is just like, damn, like that many people are just that quick to fall in line with no data, no nothing. Like we can just make things law without it really being law. And I think that was the craziest thing. But I got this little clip here too, this little news clip, just kind of breaking down, and it gives the list of colleges that still require vaccine mandates, and talking a little bit about the LionsGate production company requiring the mask mandate too. It's only the part of this clip that we're going to watch is only going to be about 55 seconds. All right. So let's take a look here, see what we got.
You're sick of hearing about COVID. So are we. The problem is what is coming because of this new wave of COVID that is really statistically meaningless. What's coming is really important because, as George predicted, some people just can't let go of the emergency. More importantly, the emergency powers. LionsGate Entertainment out in Hollywood is back to masks and testing. We talked about colleges yesterday. There are now 104 colleges in the U.S. still mandating COVID vaccines for students. Of course, faculty are exempted. Some have indicated they will never let this go. All the while, they refuse to make sense of their pseudoscience on the list. Rutgers, Harvard, and more. We can now add that Morris Brown College in Atlanta and the Seattle government, who are never wrong, the government doctors didn't get a thing wrong during COVID, they want mandatory face masks for healthcare workers.
I mean, again, guys, it's really just, I don't know why we're sending our kids or telling our kids that these schools are good to go to if they're still requiring vaccine mandates. And I mean, there's a lot of people that already got the vaccine, but if they're requiring the mandate still, that means they have to get boosted. So you're getting these boosters all the time. And I mean, guys, I never got vaccinated one time. I got COVID one time. It was really nothing, but it was a later variant too. And excuse me, but I really don't see COVID being a big deal, at least after the first or second strain. I know it was a lot more deadly in that first or second strain, but once these new ones came out, guys, it's not on that level, and when it comes to the mask mandates too, again, it really is something that I think we need to take a look at, because again, we should never mandate something like that. I think we completely went overboard on that. And there's this study here that I pulled up from ClinMed Journal. So this is an actual scientific journal. on this. And if you look here, over here in the article details, it says Journal of Infectious Diseases and Epidemiology. And it was published June 1st of 2020. So it was right in the heat of all this. And this is just a little brief summary of this whole journal. I'm not going to go into the whole journal, but we're going to go into the objective. The objective is healthcare professionals report side effects of prolonged use of PPE when caring for COVID-19 patients. This study delves into various adverse effects of prolonged mask use and provides recommendations to ease the burden on healthcare professionals. And this is from the methods. This is a cross-sectional study among healthcare professionals, primarily located in New York City, who worked in the hospitals during COVID. All respondents completed an anonymous survey consisting of 21 questions regarding adverse effects of PPE, medical history, and demographics. And the result, a total of 343 healthcare professionals on COVID frontlines participated in this study. The majority were female, 315, and 227 were located in New York City. 225 respondents identified as white, 34 as Hispanic, 23 as African American, and 61 as other ethnicity. 314 respondents reported adverse effects from prolonged mask use, with headaches being the most common complaint, which was a total of 245 out of the 343. Skin breakdown was experienced by 175 respondents, and acne was reported in 182 respondents. Impaired cognition was reported in 81 respondents. Previous history of headaches, skin sensitivity, and acne were found in some respondents. Some respondents experienced resolved side effects once masks were removed, while others required physical or medical intervention. And again, guys, I wanted to show that because it's not like these masks were just preventing COVID and didn't do anything else. And I don't know, have you seen some of these people? Like, I still see some people riding around in their mask in their car. Like, so they're driving for minimum, 20, 40 minutes sometimes, up to an hour. I mean, we're in Arizona, so everyone drives a little bit farther to get to everywhere because everything's so spread out. But, and then they wear them when they get to where they're trying to go, so they're never taking them off. I mean, it's just not good for your health at the same time. So, yeah, protect yourself if you need to feel that you need to protect yourself. But we shouldn't be mandating across the board like it doesn't do anything. All right. So, again, guys, do what is best for you and your family. At the end of the day, that's what matters. I want everybody on both sides of the aisle. I really don't care if you're left or right. I just want to make sure that we are taking care of protecting our personal freedoms and our personal liberties at the same time. All right. We can have difference of opinions. We can argue about certain laws and certain things like that. But when it comes to the core of what it really means to be an American and what we stand for as Americans, personal freedom and personal liberty stands at the very pinnacle of all this. That and the pursuit of happiness, that is what the United States stands for. And we just need to get back to that more and more. You know what I mean? So again, guys, I hope you have a good rest of your week. And again, stay blessed. I'll see you on the next video.